Good afternoon and hello. My name is Gia Wilkerson and I am with the Maryland Insurance Administration's Consumer Education and Advocacy Unit. Welcome to today's Lunch with Mia, Heart Health and Living with Hypertension. Today's topic is extremely important because there are many consumers newly diagnosed with chronic health conditions such as heart disease who have problems managing their illness. Today's event will focus on nutrition, lifestyle changes, and understanding your health insurance coverage to help you better manage your health condition. We hope that today's event will help you learn more about hypertension, tips to manage your health condition, as well as how to better understand health insurance coverage when it comes to dealing with a chronic illness. Before we get started, in an effort to reach consumers about future events, we would like to do a quick poll just to see how we all got here today. So if everyone can take a few minutes to complete the poll, that would be great. Just a few more minutes.
I think I only did the first part.
I'm sorry?
I think I only did the first part where it said was there more than just how you got the information?
No, there was just the one question.
Oh, okay.
I did not get a poll.
It should have popped up on your screen.
I show 14 people have responded, so I'm not exactly sure.
I didn't get a poll, Joyce. Gia,
Are you on a computer?
I'm on a computer.
Okay, if you move to the bottom where it shows like participants, chat, it should be something that says polls.
Not there. Not there.
I don't have it either, Gia.
Okay, well, we'll work through that.
Let's go ahead and this is Joy. Move on. I mean, because it's 12:05, we'll figure out what the glitch is. And if people who did not see the poll, if they just want to put in the chat box how they learned about this event, and the options were email, Facebook, Nextdoor, or if you found out about it some other way, just put that in the chat. And let's go ahead and get started. Thanks so much.
Okay. So to make sure that everyone can enjoy the event, we do have some quick housekeeping rules. We ask that you please leave your phones and computers on mute for the duration of the event. If you have any questions for today's speakers, please place them in the chat box as we will do a live Q&A at the end of the event. Again, thank you for coming and we will get started. Our first speaker is Dr. Arnetta Fletcher, a registered dietitian, nutritionist, and food expert. She currently serves as delegate of Maryland Nutrition and Dietetics and is a member of the National Organization of Blacks in Nutrition and Dietetics. She is also an educator and works for Shepherd University as an assistant professor and director of the nutrition program. I would like to welcome our guest speaker, Dr. Arnetta Fletcher.
So much for the wonderful introduction. Hello, everyone. I look forward to sharing some discussion with you today on the role of nutrition and heart health. Again, my name is Dr. Arnetta Fletcher, and I'm a registered dietitian nutritionist. Next slide, please. So before beginning the presentation, it's important for me to list any disclosures. For the most part, I have no major disclosures. I have no financial conflicts or global endorsements to disclose. I am, however, representing a wonderful resource for the state of Maryland. I serve as a delegate and on a board of directors for the Maryland Academy of Nutrition and Dietetics. MAND for short represents registered dietitians, dietetic technicians, students, retired healthcare professionals, and others involved in the field of nutrition across the state. We are your go-to resource for high-quality food and nutrition information. When not volunteering for MAND, I serve as assistant professor and program director at Shepherd University. Next slide, please. There are three main goals for today's presentation. I'd first like to discuss the connection between heart health, high blood pressure, and hypertension, as well as cholesterol. Once we've made that connection, I will provide you with helpful tips to maintain a healthy diet. Lastly, we can discuss our other impacts on heart health, such as lifestyle and other contributing factors. Next slide, please. Okay, so this is the meat of the presentation. When we talk about the connection between heart health, high blood pressure, and cholesterol, here's what we know. The health of your heart is influenced by risk factors. Risk factors are things that make us susceptible to various diseases or conditions. Risk factors can be modifiable, meaning we can change them, or they're there to increase or decrease our risk of the disease. They can also be non-modifiable, meaning that these risk factors are out of our control. Risk factors that we cannot include or that we cannot control include our age, gender, and our family history. For example, at every age, men have a greater risk of cardiovascular disease than women. Men suffer heart attacks more often and earlier in life, yet more than 40 million US women have cardiovascular disease, and this number is increasing. Interestingly enough, the gap between men and women likelihood of developing heart disease is closing, and this is despite all of the substantial progress made towards raising awareness, prevention, and treatment. So are you ready for the good news? There are far more risk factors that are in our control than there are factors that aren't. It's important to note that research shows that even people with a high genetic risk for developing heart disease can improve their odds of staying healthy by engaging in regular physical activity, not smoking, controlling their body weight, by engaging and eating health-promoting meals and exercise. So risk factors such as hypertension or high blood pressure, obesity and physical inactivity, smoking or tobacco use, excessive alcohol intake, blood cholesterol and triglycerides, high salt intake, diet quality, and food choices are all modified. Let's talk about two modifiable risk factors, which are hypertension and high cholesterol. For hypertension, more than 2/3 of US adults older than 65 have hypertension. Individuals with normal blood pressure at 55 still have a 90% risk of developing high blood pressure during later years. If blood pressure is even slightly above normal, it increases the risk of heart attack and stroke. Moreover, the relationship is proportional. The higher the blood pressure, the greater the risk. The relationship between early signs of hypertension and heart disease holds true for men and women, both young and old. When we talk about high cholesterol, we use the term blood cholesterol and triglycerides. These are fats in our body. Low density lipoprotein, or LDL cholesterol, and high density lipoprotein, or HDL cholesterol, are strongly linked to a person's risk of developing heart disease. LDL carries cholesterol to cells, including the cells that line your arteries. And the higher the concentration of LDL, the more rapid the progression of heart disease. The higher the concentration of LDL, the more rapid the progression of heart disease. The lower the LDL cholesterol, the slower its progression. Studies have shown that lower blood LDL cholesterols and concentrations have a more reduced risk or likelihood of developing heart disease. On the other hand, HDL carries cholesterol away from the body cells and into the liver to be used or disposed of. So they serve functional purposes such as preventing inflammation and plaque accumulation. I'm looking at some of the comments as I'm doing the presentation. So LDL, or low levels of HDL, contribute to developing heart disease. So the goal is to maintain higher HDL levels to a certain point. This is a lot of information. So it's really important for you to meet with a registered dietitian nutritionist, especially if you're at high risk for heart disease or already have it. We're food and nutrition experts and allies. We work with you to help lower your risk and help you to also improve any existing conditions by developing personalized eating and lifestyle plans. Next slide, please. Okay, so let's switch gears and discuss heart healthy strategies. Next slide. For the remainder of this presentation, I'd like to talk to you about the various steps you can do towards improving your overall heart health. These steps include making healthy food choices, being active, managing your stress levels, and trying to encourage you to stop smoking if you do. Next slide, please. So the key point to all of this is that there's no secret or magical equation to good health. Diet, lifestyle choices, and other key factors play a big role in a wide range of heart conditions. Diet influences the risk of cardiovascular disease. A diet that's high in saturated fats and trans fats, that's low in whole grains and fruits and vegetables, will increase the risk or the levels of your LDL cholesterol. On the other hand, a diet that is well chosen to include food items such as a Mediterranean style eating pattern or the DASH eating pattern can both lower the risk of cardiovascular disease. On the screen, I provide some examples about what it means to eat a health-promoting diet. We use the terms nutrient-dense foods to indicate foods that are high in beneficial amounts of carbohydrates, fats, proteins, vitamins, minerals, and other nutrients such as plant-based chemicals known as phytochemicals. Together, a diet that's composed of nutrient-dense foods as well as healthy strategies such as limiting added sugar, added salt, and your fat intake not only improves heart disease, but other diseases or conditions as well. Oftentimes, attempting to care for one condition, such as heart disease, will have a positive impact on other areas of your life. Take care of your heart by choosing foods that promote overall health. When we're making these changes, a lot of times the go-to or the norm or the fad is to just try to overhaul the diet, change everything all at once. Instead, I encourage you to make small changes, such as slowly increasing the amounts and types of fruits and vegetables that you consume, adding more whole grains to your plate, choosing plant-based proteins such as beans, which will also provide added fiber, and being selective about your seafood choices because they provide healthy fats such as omega-3s. Omega-3s are those fatty acids that are a special type of unsaturated fat, and they're commonly found in beneficially fatty fish, such as salmon, mackerel, tuna, and herring. They're also found in walnuts and flax seeds. So I encourage you to look into those omega-3 food choices. Next slide, please. Okay, so I'm going to try to break down these guidelines a little bit more for you. When it comes to managing heart disease through the diet, fruits, vegetables, and fat choices are your greatest allies. They matter. Fruits and vegetables are high in dietary fiber and antioxidants, and they're also able to keep your blood pressure in check. Since high blood pressure is a major risk factor for heart attack and stroke, increasing your fruit and vegetable intake can lower your blood pressure by providing potassium. Potassium is a mineral that has been shown to lower blood pressure in clinical studies. The type of fat you consume will also make a difference. Based on our national guidelines, we should limit our saturated fat intake to less than 10% of our total calories. An eating pattern such as the Mediterranean and DASH diet or DASH eating plan that I mentioned earlier is just a fancy way of describing what you eat in a day. When an eating plan is high in saturated fats, it may increase your risk of high blood pressure. Foods such as bacon, sausage, fatty meats, butter, ice cream, and other full-fat dairy products can be high in saturated fats, as well as sodium. It's not to say that these foods should be eliminated from the diet, but instead they should be carefully selected. Practice moderation and choose the no to low fat options when possible. Current recommendations also indicate the need to avoid trans fat. Trans fat is and should be prohibited in most cases, as it was banned in some regulations for food manufacturers a few years ago. This is important because these types of fats can clog arteries. They can also raise cholesterol levels. Trans fats can be found in commercial packaged goods like packaged wrapped honey buns or fried foods. So the goal is to replace the sources of saturated fats and trans fats with primarily unsaturated fats. Not only is this replacement beneficial in reducing the quote unquote bad cholesterol, which I don't like to use that term, LDL cholesterol, but it may also lower your risk of heart disease. It can also, I guess by looking at these unsaturated fats, you can also help incorporate the beneficial types of cholesterol, which is considered high density lipoprotein or HDL cholesterol. So one way to do this is to incorporate foods such as olive oil, canola oil, avocados, nuts and seeds that all contain unsaturated fats. Next slide, please. Okay, so step 2, to be active. Of course, there are other preventative measures that you can take to reduce your risk of cardiovascular disease. It will soon be evident by taking these same steps that they're also protective against a number of other diseases as well. So first, I encourage you to study yourself. It's common at this point for a number of people to be at risk for heart disease. It's important for you to know what they are. You can assess yourself and your present heart condition. If you don't already know, try to find out more about your family medical history. And probably the most important thing to studying ourselves is to own and act on our own lifestyle habits that are harming our health. If you have diabetes, high cholesterol, plaque buildup or atherosclerosis, and hypertension, it's imperative for you to take action immediately. You can seek medical help. We're here to help enhance the lifestyle choices that you're making. For individuals who are considered overweight or obese, gradual weight loss can result in overall better health. Even a 3 to 5% loss in body weight can lead to health improvements in people that have risk factors for heart disease. People who are taking medication to control their blood pressure can often, if they lose weight, can cut down on their devices or eliminate them altogether. Weight loss in people who are considered overweight or obese also improves their blood lipid levels and their glucose response, which helps to reduce not only the risk of cardiovascular disease, but diabetes as well. Regular physical activity is beneficial. Physical activity is important because it stimulates the development of new coronary arteries that nourish our heart muscle. This is an important factor in recovery for people who are following medically prescribed exercise regimens after experiencing a heart attack. Physical activity also favors lean muscle development, and that can lead someone towards a healthy body composition. There are general guidelines for physical activity, and this is to participate in at least 2.5 hours of moderate intensity physical activity per week, or 30 minutes of exercise or activities a day. These activities include jogging, biking, and dancing, all of which can improve your odds against heart disease. Moderate to vigorous intensity physical activity, such as weightlifting, may be required for weight loss. But start wherever you can, because even simple activities such as walking can help to incorporate balance and flexibility, and that makes a difference. Consult with a physician or healthcare provider before starting an exercise program. Okay, so let's move on to step 3 and step 4. And we're going to talk about stress and smoking. Stress, whether it is physical or emotional, affects our overall health. Stress can impact heart disease because stress strains the heart, and that could potentially cause blockages from years of fat and other accumulating things within your arteries. This, of course, can also lead to heart attacks. So step 3 involves managing your stress levels. Even if you're eating right and exercising regularly, poorly managed stress can wreak havoc on your health. So getting enough sleep, practicing relaxation techniques, and nurturing relationships are examples of healthy habits that can help protect you from the harmful effects of stress. I also provide some other examples on the screen. So rather it's yoga, ping pong, walking, jogging, meditation, or dancing, whatever works for you. The key is that you figure out a way to manage or reduce life's stress. For step 4, these recommendations fall in line with controlling alcohol intake. If someone consumes more than moderate amounts of alcohol, it could increase their risk of heart disease. Tobacco smoke, on the other hand, damages arteries. So for this and probably 100 other reasons, smokers are encouraged to quit and non-smokers are advised to avoid exposure to secondhand smoke. We know that this is difficult, but it is well worth the effort. Smoking increases your risk of heart disease, among other complications, and studies have found that when smokers quit, their risk of heart disease begins to diminish in a matter of months. Next slide, please. So to summarize all of this, it's important to know that most risk factors are related to heart disease are modifiable. Diet and lifestyle changes are needed to maintain good heart health, but it's the bigger picture of managing stress and other lifestyle factors. The goal is to incorporate slow dietary changes consistently over time to improve your heart health by reducing cholesterol and blood pressure levels. Individuals shouldn't try to do this all on their own or by themselves. In fact, you're encouraged to work with a qualified health professional, such as your doctor or a registered dietitian, to identify your needs. We can see things from a different perspective and develop an individualized eating strategy. A lot of times when we're working with clients, the first thing that they do is sort of a guilt-induced kind of a deprivation approach where they try to cut out everything, cut out sugars, cut out salt, torture themselves by not having dessert for a week or a month. But that's not a healthy approach. It's in general, we find that if you restrict yourself, you're just going to want the item more. And even if you could be consistent on a couple weeks on some fad diet, oftentimes those wants and needs build up over time. And so once you fall off of the diet or you stop doing that diet, those cravings come back even stronger. So if you notice the patterns with fad diets, for example, you'll notice that right after you stop, you'll gain weight back even faster. It's not the individual's fault, it's the way that these poorly designed diets are structured to function. So I give you these summary reports and encourage you to work with someone in terms of best finding the approaches that work for you. And last slide is just to say thank you and to provide you with some additional resources. So of course, most of the information that I use is reinforced and reiterated by the Academy of Nutrition and Dietetics, as well as the American Heart Association as some of the top national resources. I also volunteer for Maryland Academy of Nutrition and Dietetics, and we can start with your in-house local resources to finding qualified information. I provide you with my contact information, so you're free to reach out if we have any specific questions. And I thank you for this time and this opportunity to speak with you all.
Thank you, Dr. Fletcher, for that wealth of knowledge. Up next, we will have Ms. Patricia Dorn, who is the lead outreach staffer of the Consumer Education and Advocacy Unit at the Maryland Insurance Administration. Ms. Dorn.
Thanks, Gia. Hi, my name is Patty Dorn with the Maryland Insurance Administration. I'm going to talk to you today about understanding your EOB and seeing a specialist out of network. Next slide, please. So the Maryland Insurance Administration, we're the state agency that regulates the business of insurance in Maryland. Or the entity that licenses the insurers and the insurance producers, so your agents and your brokers, to sell insurance and offer insurance in Maryland. We examine their business practices to make sure that they follow the laws. We monitor the solvency of those insurance companies. That means we make sure that they have the money to pay your claims. And we review rates, the premiums, the rates that are charged to you. And we're the entity that you can contact if you have a problem with an insurance company, an insurer, or a provider, so an agent or a broker. If you have issues with those entities, you can file complaints with us and we will investigate, as well as complaints of allegations of insurance fraud. Next slide, please. For time, I'm going to skip this one. Next slide. So I'm going to talk to you about understanding your explanation of benefits. So after you receive medical care, your health insurer is going to send you information about that claim called an explanation of benefits, or EOB. And most of us have received EOBs. And most of us have received services through, health insurance, and we've received these EOBs in the mail. And number one, it's important to know that the EOB is not a bill. It usually says in big letters, the EOB is not a bill. And that's important to know. But also it's important to understand that it isn't a bill, but it's also not junk mail, right? So, okay, it's not a bill. I don't have to pay it right now. I don't have to deal with it. Set it aside. That's an instinct that you do with some things sometimes that aren't a bill, that come in the mail. But it is really important that you take the time to review your EOB. It's important that you review it to make sure that it's accurate. And that's why I'm going to go through this a little bit, give you a little bit of snapshot. So you're familiar with it before you open it. I mean, I think that's much less intimidating than, just opening it and trying to figure it out. And especially if you're just not feeling it, you're not feeling like thinking about finances and bills, it can be stressful. But I do want to encourage you, you get that EOB in the mail, please open it, look at the important things and make sure it's accurate, because there's your opportunity to tell your insurer or your provider, there's something wrong here. So the EOB is the insurer's explanation of how the costs of services are shared between you and the insurer. So it's telling you what they're paying and it's telling you what you have to pay. The EOB tells you how much each provider charged. And so again, by provider, the doctor, for example, the hospital, the person who gave you the service, how much that provider charged, how much the health insurer paid, and then how much you owe the provider. Be sure that you compare the owed amounts on your EOB with amounts on bills from the providers that you've already paid. Next slide, please. So this is kind of a little generic snapshot of an EOB. Not all EOBs look exactly alike, but they usually are similar. On the next few slides, we're going to talk about a few things to look at when you open that EOB. And I apologize if some of these are a little bit blurry. The information about the person who received the services. So, you're going to see your name and you're going to see your member ID. Okay, great. You glance at that, make sure that it's your name or, the name that you're expecting on this EOB. It's going to include your health insurance ID number in case you need that, and the member name, sometimes identified as the patient. So it might say patient name and then your name. If it's your insurance, so if you're the one carrying the insurance, the EOB often refers to the patient as self. If your insurance is through a spouse or a parent, then their name is going to be on the EOB. Next slide. So the EOB will include, usually on the left, it's going to include a list of the services received. So maybe this is just an EOB for one service. Maybe it's an EOB for multiple services. It's going to include that list. It's going to include the dates, and it may also include billing codes. Next slide. So information about the provider or the facility. This is going to name the person. So the doctor, nurse practitioner, psychologist, whoever it was, or the facility. So possibly the hospital name that provided the service. And so that's going to be the information about the provider or the facility. Next slide. And then the billed amount. So most likely over to the left, like it is here, there's going to be a billed amount. And this is the amount that the provider or the facility billed your insurer. So this is how much they billed them. And then what's in that red box? That's the allowed amount. The allowed amount is the amount that the insurer will pay the provider for the healthcare that you received. So in the first line here, they billed $500. The allowed amount, $444. The allowed amount is negotiated between the provider and the insurer. Next slide. So yeah, this one's particularly blurry, sorry. The amount you owe the provider. Okay, so that's going to be under member liability, or something that sounds really similar to member liability. That's going to be telling you what you're going to have to pay when they bill you. It may also include money that you paid during your visit. So it's the entirety of it, some of which you may have already paid. Next slide, please. There's going to be information about denials and other details or notes. So this is important. The insurer may use codes to explain denial reasons and notes, and you should see an explanation of these codes on the EOB. Next slide. So how else is an EOB helpful? An EOB helps you track how much you've spent out of pocket for the year for your covered healthcare costs. It can help you understand how far along you are in meeting your deductible and your out-of-pocket limit. If you know that you've reached your out-of-pocket limit, so you've reached your out-of-pocket limit for the year, but you're asked to continue to pay for services, you need to contact your insurer right away. And on the EOB, you're also going to find instructions on how to file a grievance or an appeal in the case that your insurer denies coverages for services or they're only paying part of the claim. So you should see information there on how you can file the grievance or the appeal. Next slide, please. Usually the insurer sends the EOB to the primary person on the health plan. So maybe that's you, maybe that's your spouse. If an employer provides the insurance, the employee usually receives the EOB, including the EOB for the spouse and the dependents. You may ask the insurer to send your EOB to a different address for confidential services, or if the information on an EOB would put you in danger. Okay, so this is important. And in a situation where someone has insurance under someone else and they don't want that person to have access to their medical information, they can reach out to the insurer and have the EOB sent to a different address. On the bottom here is a link. Most of what I said here about the explanation of benefits, the EOB, is available in a video on our YouTube page. And that is what that link is here. Next slide, please. So I'm going to talk to you a little bit about seeing a specialist. So this is in-network versus out-of-network. Your health insurer has contracts to pay set amounts for services with certain healthcare providers. So in the EOB, we kind of saw an example of that. They billed $500 and they were paid $444, right? So that's what the contract said that they're going to pay for that service. And these providers are part of your provider network. The provider networks, they're made up of service providers like the doctors and the hospitals who have a contract with your health insurer. So they already have a contract. And they're known as in-network providers. And when you use in-network providers, you generally need to pay only your deductible and any applicable copay or coinsurance. And you will not be billed the balance for the provider. So the balance, that difference between the $500 and the $444. So you won't be billed that $56. But an out-of-network provider does not have a contract with your insurer. Next slide, please. Charges for covered services from an out-of-network provider may not be paid by your insurer, or your copay or coinsurance could be more than had you gone in-network. And you may also have to pay additional amounts of money called balance billing. So that $56 would be part of balance billing. Balance billing happens when a healthcare provider bills a patient after a patient's health insurer has paid their share of the bill. So the balance bill is for that difference, the difference between the provider's charge and the price that the insurance company set after you've paid the copays, coinsurance, and deductibles. Next slide, please. So balance billing can happen when a patient receives covered services from an out-of-network provider or facility. In-network providers, again, agree with an insurance company to accept the insurance payment in full, and you're not going to see that balance bill. You shouldn't be getting a bill for that $56. If you do, you need to contact your insurer and the provider. Out-of-network providers don't have the same agreement with insurers. So that's just the really important thing. Next slide. Starting in 2022, a new law went into effect, and this is the Federal No Surprises Act. I'm going to talk about it for just a minute. It may protect you from many types of surprise bills. So, but just so you know, we are going to have an entire event about the No Surprises Act, a 1-hour presentation about it on February 16th. So if this ends up being something that you want to learn more about, I do encourage you to tune in with us on February 16th. So what is surprise billing? So surprise billing happens when a patient receives an unexpected balance bill after they receive care from an out-of-network provider or an out-of-network facility, such as a hospital. It can happen for both emergency and non-emergency care. And typically the patient doesn't know that the provider or the facility is out of network when they receive this bill. So some states, including Maryland, have laws or regulations that protect patients against surprise billing. But the state laws generally have not applied to the self-insured health plans. And most people who get coverage through an insurer are in self-insured health plans. And so just real quick, that means, especially for people who work for a large insurer or a large company, if you work for like a Lockheed Martin or a Raytheon or something like that, you probably have a self-insured health plan, meaning essentially your employer, pays the bills, pays for your health insurance claims. You have an insurance card. It has an insurer on the insurance card, but they're more like the administrator. So for these self-insured plans, which are plans that most people get through employment, large employers, but also government entities, like for example, the state of Maryland. So now this federal law protects consumers in self-insured plans, as well as consumers in the states that did not have their own protections. Next slide, please. So it protects you from these things. Surprise bills for covered emergency out-of-network services, including air ambulance services. That would not be a fun bill to get, but not for ground ambulance services. And it covers you for surprise bills for covered non-emergency services in an in-network facility. So a situation where you thought you were doing everything right and you thought you were staying in network, but there is a provider at this facility who attended to you who was out of network. That's a surprise to you. And so that's one of these things that is covered under this No Surprises Act. It also gives you the right to receive a good faith estimate of costs if you're uninsured or a self-pay patient of an out-of-network provider. And at the bottom, there are a few links if you want to know more about the No Surprises Act. But again, I do encourage you if you want to tune in with us in February. Next slide. If your health plan does not cover out-of-network providers at all, such as an HMO, you may be responsible for the entire cost of services. However, if your HMO or other insurer does not have an in-network specialist with training and expertise to treat a certain condition or disease, you may request approval from your insurer to see an out-of-network specialist. If that request is denied, you do have the right to appeal that denial. So before you visit an out-of-network provider, make sure that you understand what you need to pay, what your responsibility is going to be. Contact the provider and definitely talk with your health insurer. To find an in-network provider, start with the online provider directory. Or just remember, networks can change, right? They can change from moment to moment. It might not be completely up to date. You can call the member services number on the back of your card to verify. And at the bottom here, I just have our information, our website, www.insurance.maryland.gov, and our phone number. If you have questions, 1-800-492-6116. And with that, I'm going to pass it back over to Gia.
Thank you, Patty, for that wonderful information. So at this time, we are going to start the Q&A portion of the program. If you have any questions for either of the presenters, please place them in the chat box at this time.
All right, so let's do a nice low carb meal.
Mr. George, did you have a question? Okay. In the meantime, so that we can evaluate the quality and content of the event, we are also going to place a brief survey in the chat box, and it would be great if you could fill that out for us. And we have a few more upcoming events in the month of January. Our next event will take place on January 18th at 11 a.m. on Medicare supplements. And then our final presentation for January will take place on January 26th at 12 p.m. We will have a resource fair where we will have the United Way and the Maryland Department of Aging. We hope that you are able to join us.
And Gia, actually, we have one other event on January the 19th. It's going to be focused on various health insurance scenarios.
Oh, thank you. Okay. And as always, to stay up to date on any of our events, please feel free to follow us on social media, Facebook, Twitter, LinkedIn, and Instagram. We do have one question from Ms. Elizabeth. She asked if we could talk about different peanut butters, natural versus regular as far as fats. She eats peanut butter several times a week, so it's very important for her to know what is the best type for her to eat.
Hi, so I am glad to answer that question. And I'm actually going to build it and kind of bring it back out a little bit. And so whenever we're talking about heart healthy approaches, anything that's in regards to reducing or relieving conditions, reducing your risk for chronic diseases, the first thing that we talk about is actually trying to get the overall diet in balance. And the reason why we talk about overall diet quality first is because if the diet isn't balanced, it doesn't matter the type of source, or rather it's natural or unnatural types of food products, or organic or non-organic. And so the first thing that we always talk about is trying to get someone's diet in balance first, making sure that they're consuming the proper amount of carbohydrates for their system, not necessarily putting them on a low carbohydrate diet, but making sure that they're getting the adequate amount of carbohydrates, the adequate amount of fats, a balance of those fats. So are they consuming less than 10% of, or around 10% total saturated fats? Are they consuming enough polyunsaturated or unsaturated, monounsaturated food sources? Are they getting enough protein? Once you have an idea of how someone's overall diet looks, then you can comment or discuss the impact of individualized foods. And so to answer that question, there actually isn't an answer to that. You have to work with a dietitian to understand where your diet is at and how do each of these foods benefit you. So for example, if you're eating peanut butter several times a week, what does the rest of your protein intake look like? Are you getting an adequate balance of plant-based or animal-based if you consume those products? Are you getting a variety of plant-based sources besides peanuts, for example? What does that look like for you? And what is the composition of those food sources? How much fat does the peanut butters have in them versus the other protein or fat sources that you're consuming throughout the week, for example? So to talk about that is to talk about the overall diet quality first, which is why you're very much encouraged to reach out to health professionals to get the individual insight and look into your diet. So I hope that helps to better address that question.
Thank you so much, Dr. Fletcher. Do we have any other questions? Please feel free to put them in the chat box. Guess we'll give it a few more minutes. Okay, and the results are in from the presentation poll when we asked, how did you find out about this presentation? And it looks like a majority of our participants found out via email. Okay, so I am not seeing any other questions in the chat box. I would like to thank everyone for attending today's live event. Dr. Fletcher and Mrs. Dorn, thank you so much for your wonderful presentation. The presentation will be available within the next few days on our YouTube page. Again, please feel free to follow us on all social media platforms. Have a great day and stay safe.